Rough and dry feet can be a common problem that affects people of all ages. The condition can be caused by several factors, including dehydration, poor hygiene, exposure to cold weather, and overuse of harsh soaps. In severe cases, rough and dry feet can lead to painful cracks, infections, and bleeding. Fortunately, with proper care, you can prevent and treat rough and dry feet. Here are some tips on how to care for rough and dry feet. Soak your feet in warm water. Soaking your feet in warm water is an excellent way to soften the skin and ease discomfort. Add Epsom salt or a few drops of essential oils to the water to relax your feet and improve circulation. Soak your feet for 10 to 15 minutes, then use a towel to dry them thoroughly. Exfoliate your feet. Exfoliating your feet helps remove dead skin cells and promotes healthy skin regeneration. Use a pumice stone or a foot file to gently scrub the rough areas of your feet. Be gentle, as excessive scrubbing can cause irritation and worsen the condition. Apply a moisturizer after exfoliating. It's essential to apply a moisturizer to your feet to retain moisture and prevent dryness. Look for creams or lotions containing ingredients like urea, petrolatum, or shea butter, as these help hydrate the skin. Apply the moisturizer to your feet generously, spread evenly, and massage gently. Wear comfortable shoes. Wearing tight or ill-fitting shoes can cause friction and pressure points, leading to rough and dry feet. Choose shoes that fit well, have good arch support, and enough room for your toes to wiggle around. Avoid wearing shoes made of synthetic materials that don't breathe, causing sweaty feet. Invest in quality socks. The type of socks you wear can significantly affect the condition of your feet. Wear clean, breathable cotton socks that allow air circulation and absorb moisture to keep your feet dry. Avoid wearing nylon or polyester socks that trap sweat and cause bacterial growth. Keep your feet dry. Moisture is a significant enemy of the feet. After showering, swimming, or any activity that causes your feet to become wet, dry them thoroughly with a towel. Moisture can lead to fungal infections that cause dry and rough feet. Use foot powder. Using a foot powder can help absorb excess moisture, minimize friction, and prevent odor. Apply the powder to your feet and between your toes before putting on your socks and shoes. Practice good hygiene. Keeping your feet clean and dry is essential in preventing rough and dry feet. Wash your feet daily using mild soap and warm water. Dry your feet well, especially between your toes, where fungi thrive. Trim your toenails straight across and avoid cutting too close to the skin. Stay hydrated. Your skin uses the moisture in your body to stay hydrated and nourished. When you get dehydrated, the water in your body is used for the highest priority functions, like blood flow, before it is used in the skin. By drinking at least 8 ounces glasses of water per day, the skin all over your body will stay hydrated and not dry out quickly. End conclusion. Caring for rough and dry feet involves simple but effective measures that promote healthy skin regeneration. If you experience severe cracking or bleeding, seek medical attention. Follow these tips regularly and enjoy smooth, soft, and healthy feet.